We could make North Carolina a state that's traditionally and historically been one of the poorest health states. We could make it into one of the best. In the last decade, our test scores in our public schools went up more than any state in America. We could do the same thing with health care if we really, really are serious about it and work hard and get everybody working together. So folks, it is a job for all of us, as we said from the beginning. My health is your business, your health is my business, it's all of our business. We care about this state, we care about every human being who lives here.
When I started this work on healthcare in '93, 46% of the Fortune 500 companies had adequate health policies for retirees. Today, 29% do. So you can say you don't want to fool with this, but it's just going to get worse.
President's budget calls for $137 billion in cuts over the next 10 years in mandatory programs, with much of that coming from Medicaid. How are you going to close these disparities as opposed to widen them if you don't put resources into them?
50% of bankruptcies in this country are because, or have one of the major underlying reasons is because of health problems or health bills.
We have to care for people whose bodies wear out. We have to care for people whose minds wear out. But we got to make up our mind that the percentage of us who wear out is going to be smaller than it ever has been in history, because there's just going to be too many of us, and we cannot put that burden on our children and our grandchildren.
In all, we have 1.4 million people in our state without health insurance at any given time. That's an increase of 300,000 without health insurance just since 2000. And of that 1.4 million that are uninsured, 275,000 among them are children under the age of 18.
The real problem we got is, in fact, health care. More and more companies are providing less and less insurance. More and more people are finding themselves without any access to health insurance at all. While the numbers of the uninsured are going up, the number of policies are going down, the number of companies that are providing health insurance because of the costs are diminishing, yet the requirements and the needs of the people are increasing, and the costs of providing those services are increasing. Not in the year 2042, but right here, right now, right here today, there are 44 million people in America who have no health insurance at all.
You'd be amazed at the stuff I have to take every day now that I got this cut open chest of mine. And you know, I can afford it, but I just kept thinking, what about all the people like me who don't have the health insurance I have, don't make the kind of money I make, and they need this medicine bad as I do, and we need them in our society.
But I do think that we should be looking at expanding public programs for those people below 200% of poverty. 29% of the uninsured in North Carolina live below poverty, and another 33% live below 200% of poverty. Those people cannot afford private plans without subsidies. We have to be realistic.
In December 2004, the American Journal of Public Health reported that 886,000 more African Americans died between 1991 and 2000 than would have died had they had equal health care to white Americans in this country.
We've got to find a way to share the risks and to lower the administrative costs in the financing system. No other country in the world finances health care the way we do, which is why almost every other country with any money covers 100% of the people at a much lower cost.
As a general rule, governments won't count any savings as having been saved, so everything is a cost, so you can't afford to do the new thing that'll work because you're too busy paying for the old thing that doesn't work.
But what we really sought to do in this program was make each and every employee a better consumer of health care. And the critical point was to convince them that the person that is most determinant on their health care is themselves. And I believe they've got that point, and that is what we need to continue to push. Our average employee health care cost 3 years ago was $3,800 a person. Last year was $2,750. 27% decrease in average health care costs.
I've described two common sense principles that we should keep in mind as we reinvent Medicaid. Everybody pays something for everything, and pay for the important things first. Let me suggest a third principle, and that is to pay for what works.
In medical practice throughout America, believe it or not, there's still a time lag of several years between when a new technology is developed, or new procedures developed, and its regular implementation in the medical system. That's a management issue. It's not a health care issue, and it's not a political issue.
And the best thing that we can do for long-term sustainability of Medicaid, and I believe of all our programs, is that it must be local. Good health status, as I said before, is not just a medical challenge. All community providers and agency must be around the table, must be part of the program that will enable our networks, our community care networks, to solve community health issues and work with individuals.
You know, you often hear the term that we spend more money than any other country in the world on health care, and we have not as good health outcomes. Now, is that because the government doesn't run our health system? I don't think so. Or is it really because, as a society, we've chosen to believe that we can live any way we want to live, we can eat anything that we want to eat, we can be as physically inactive and live on our couches as much as we want to, and that medicine will be there to save us? Well, to some extent, medicine will be there to save us. But it's one heck of an expensive way to do this, and I don't think it's the right way.
Poverty has increased 14% since 2001. The more poor people there are, the more uninsured people there are, the more burden it is on the government, the bigger the deficit is. You cannot have a healthy population with poverty going up. Poverty's got to be going down.
In fact, we are trying to change Medicare right now so that it will pay for preventive care and wellness, and that's a significant experiment that's underway. And part of the challenge is we don't quite know how to do it, but I think that's exactly the direction we should be moving towards.
This is not a problem any state is rich enough to solve alone. We have to do this together.
So what our great country is confronted with, in my view, is the fact that both parties seem to have adopted a kind of pragmatic theology, which is win at any cost, including to our children. And one might ask, in this all gain and no pain world, in this all get and no give political world, has it become too politically incorrect to ever suggest that there are times in the history of this country when some of us might be expected to give up something for the greater good?
Offering a helping hand to the poor when they're sick, when they're vulnerable and scared, believe me, my heart is right there, along with the hearts of a lot of other Americans. These are matters of deep personal and religious values. Our hearts are there. What I want to say today is we need to use our heads too. If we keep our eyes on the fundamentals, on getting the principles of economics to work for us with incentives in the right place, if we get the fundamentals right, we'll do fine. But if we don't get the fundamentals right, if we don't get the economics right of this program, if we don't get ahead of what's happening in healthcare in our country, no amount of tinkering around the edge with secondary issues will save us from failure.
I want to show this is a picture of the Red Sox winning the World Series and celebrating as evidence that the unexpected can happen. If you work hard and if you want to make it happen, and if you're a baseball fan, you'll remember that the slogan for the Red Sox was, "Why not us?" And so I want to close by saying, why not us? Why not North Carolina? Why not take the lead? Why not now? Thank you very much.
And we are now committed together to go out and make North Carolina a healthier place, and to make this place all that it can be, and all that it should be, and all that it must be.